Cancer. Cancer is a disease of a person's genes. It is not caused by a single pathogen like infectious diseases. Cancer is a non-infectious disease. It is not transferred between people. When many mutations arise in the DNA of one cell, that cell may lose control of the cell cycle. A cell that stays in the cell cycle and never stops dividing is immortal. Not all immortal cells are dangerous, though. For example, immortal stem cells are needed to continually make new blood cells. But cell immortality greatly increases the risk of cancer and is a step in the development of a cancer cell. Except, of course, for those we need. Cancer cells are adult cells that have become immortal due to mutations and then spread to other parts of the body. They stay in the cell cycle, they cannot die, and then they form a tumor. When the tumor spreads, it causes the symptoms associated with cancer. Normal adult cells are not immortal. Their proliferation is limited because they either stay in G0 of the cell cycle or die after about 50 divisions. G0, that's where cells are not dividing. They are performing their allotted functions in the body. They could start dividing again when needed. A cancer cell typically has many different types of mutations that cause loss of control of the cell cycle. Cell cycle control is a system that allows cells to repair themselves, it keeps adult cells in G0 where they're not reproducing, or causes them to die if they become dangerous. A cancer cell may have mutations in a cell signaling pathway, a gene needed for apoptosis, which is programmed cell death, a gene needed for the repair of damaged DNA, a gene that controls a cell cycle checkpoint, and more. You might want to pause on this video after we talk about it and just study the cycle here. Normal cells only undergo mitosis if they are allowed to pass checkpoint controls during the G1, G2, and M phases of the cell cycle. So here we have cell growth, here's DNA synthesis, and here's some more cell growth. Abnormal cells will be stopped at checkpoints for repair. If they cannot be repaired, they undergo apoptosis. They're destroyed. Cancer cells have mutations in their cell cycle checkpoint genes. They are abnormal cells that continue to divide even if they have dangerous mutations. And they skip the checkpoints and they can keep reproducing. And here's the G0 part that we talked about. That's where the cells are not dividing, they're just doing their job. And of course, mitosis is where you have cells reproducing, you have one cell splitting and coming up with two daughter cells. Any cell in the body can potentially become a cancer cell if it has a lot of mutations. Each type of cancer is named for the type of cell that gave rise to it. For example, cancers of blood cells are called lymphomas or leukemias. Cancers of bone cells are called sarcomas. Cancer cells keep dividing and form tumors, and tumors are large masses of abnormal cells that do not support bodily functions. Tumors may be benign, that means they're in one place and not damaging, or malignant, they are spreading and damaging. The process of cancer cell spreading is also called metastasis. Malignant tumors cause illness when they spread, metastasize, and damage parts of the body. For example, bone cancers become deadly when they spread to the lungs, damaging the lung tissue. Breast cancers become deadly when they spread to the brain or the bones. Healthy immune systems play a role in cancer prevention. Cancer cells come from a person's body, so they often look like self to the immune system. Unfortunately, some cancer cells are ignored by the immune system because they don't look like foreign invaders. But some cancer cells can appear to be non-self if the mutation has changed their cell surface. In this case, the immune system acts like a protector and kills them. NK cells, over here, the innate immune system, and cytotoxic T cells of the adaptive immune system may kill the cancer cells. Here's an illustration of one right here. Most mutations are just bad luck, and most do not cause disease. However, some cause loss of control of the cell cycle and metastasize. The greatest risk factor for cancer is old age. because as people age, these cells accumulate more and more mutations. The risk of accumulating mutations that cause cancer increases with exposure to environmental toxins such as smoking, excessive alcohol, poor diet, radiation, or toxic chemicals. Another risk factor for mutation in cancer is infection by certain viruses. Finally, certain underlying health conditions such as poor digestion or a family history of cancer are risk factors for some people. Other common cancers occur in the esophagus, breast, bladder, prostate in elderly men, and non-Hodgkin's lymphomas, mostly Burkitt's lymphoma, a cancer of B cells common in children. Smoking is a risk factor for esophageal, mouth, throat, voice box, stomach, kidney, pancreas, liver, bladder, cervix, colon, and rectum cancers, as well as acute myeloid leukemia, a cancer of white blood cells. So this just isn't any good for you. Access to health care can help detect many cancers at early stages when it is treatable. Early detection of breast and prostate cancers, for example, typically allow successful treatment of the disease. While some cancer risk is attributed to genetics and bad luck, the risk of cancer can be decreased by not smoking, drinking only in moderation, getting proper nutrition, and avoiding infection with HIV, HPV, and HBV.